Hi guys, welcome to my channel. Thank you so much for your constant support and for always coming back to the channel. As promised, I'm bringing you the part 2 of the NMC OSKI tips. The other video, which is here, was talking about the OSKI API, which is the assessment, planning, implementation, and evaluation. And today I'm going to talk about the OSKI skills only. And so stay tuned whilst I delve into this video. If it is your first time of ever coming across this channel, my name is Rebecca Ajiman, a BSc RN from Ghana, currently practicing in England as a registered nurse. If you're a returning subscriber, I say a very big thank you for all of your support and for always coming back to the channel. On the OSKI day, it doesn't matter whichever one you get first. You can be given the OSKI API first or the skills first. You can be given the skills first and the OSKI API later. Whichever one comes first, you just have to be ready to give out your best and to assay your exams at first attempt. So I'm going to be mentioning the skills that we have in the OSKI exams. They are basically 10 skills, and from these 10, you are going to be given 2 tasks to perform. It doesn't really follow any particular order. So for instance, if your first task was to do a midstream, catheter urine or a catheter sample of urine collection, that doesn't mean that your next task is going to be a catheter removal. It doesn't really follow that order. Like all the urinary procedures are going to be given to you, or let's say you're going to get ANTT and something, or if you get IM, it means you're going to get your next task to be a subcat. No, it doesn't work that way. They can actually give you any skill at all to perform. So I'm going to mention the 10 skills and tell you how to generally approach them and how to pass it. So a quick overview, there are 10 skills I'm going to mention, and we have the aseptic non-touch technique, otherwise called the wound dressing. We have catheter removal, midstream urinalysis, catheter sample of urine, peak flow rate calculation, administration of inhaled medication, intramuscular injection, subcutaneous injection, fluid balance, and the last but not the least, resuscitation. Because of the COVID, latest COVID crisis, resuscitation has been taken out briefly for the moment. However, it may come back, but at any time that it comes back, your clinical instructors will let you be in the know. So these skills that I've mentioned comes in no particular order, and the fact that you're going to get A doesn't mean definitely you have to. But as far as I know, nursing is generally the same. Nursing in Ghana, nursing in Africa, nursing in the UK, US, the concept is the same, the physiology is the same, the rationale and the why behind the things that we do are generally the same. It's just that in the UK, the equipment and the approach that they use may differ, and that is why you need a clinical instructor. However, I know quite a couple of people who have done these exams without any instructor. They learned on their own, they read books. As I mentioned in my previous video, I gave some a book that you can use. They read books, they watch other people's videos like what I'm doing now, and they were able to pass the exam without any clinical instructor. It's the duty of this instructor to tell you how the approach of going about things as well. So you're giving ANTT, that is aseptic non-touch technique, and from the name you can tell that is otherwise called wound dressing. So you're giving a wound and you are told to dress the wound, and you're using a non-touch technique, an aseptic technique, to dress this wound. So you have to make sure that everything is sterile, your field is sterile. And one thing you have to note when you are doing the skills, if you are using any equipment, immediately you take the equipment or that item, you look at the expiry date and you verbalize the expiry date. You verbalize that the item or the equipment is safe to use. You verbalize that it is not expired, it is intact, and you are happy to use it. So make sure that whatever the procedure you are doing, whatever equipment you are using, verbalize the expiry date and all that. Also make sure that if it's a tray or trolley you are using, it has been cleaned with soap and water within the last 24 hours. So the examiner will tell you it's been cleaned, but just still say it that it's been cleaned within the last 24 hours with soap and water, and you're happy to use it. You can then go ahead and use your clinical wipes or your antiseptic wipes to clean it thoroughly, to make sure that it is clean for the particular procedure that you are going to be using it for. And before you do any procedure at all, before you assemble your equipment for any procedure at all, first go to the patient, do your identity checks, do your allergy checks, do your comfort checks, which is asking the patient whether they are in pain or they are comfortable. Do all those checks, explain your procedure to the patient before you go and get any equipment at all to move to the patient's bedside. Provide privacy. If it is a procedure, you need to provide privacy. Make sure you provide privacy. If it is a procedure that requires you to, expose the patient, private parts like the urinary procedures, you can ask the patient if they want the presence of a chaperone to be around to actually see or to, be as a witness to whatever you are going to do. If they say they are fine, then you can go ahead to perform your procedure. Make sure that before you assemble your equipment, you wash your hand thoroughly with soap and the running water, or you use your hand gel and you verbalize the steps of the WHO standard that you are going to be using to wash your hands before you assemble your equipment. Well, remember to protect the bed with your Inco pad or anything to protect the bed before you remove the catheter, and also educate the patient after the removal of catheter. Tell them what they are supposed to do. So for example, you're supposed to take about 2.5 to 3 liters of water in a day. You have to perform Kegel exercises to make your bladder and your pelvic tight. And if you notice any signs of infection, you can let me know. And so in midstream urinalysis, you also have to ask the patient whether they are happy to collect the urine by themselves or if they want you to collect the urine for them. And when you are doing the urinalysis, you wait for the required period of time to read the urine. Don't be in the haste. If you can't wait, just verbalize that you have to wait for this time. You have to wait for this time to read proteins. You have to wait for this time to read the pH of the urine. You have to wait for this time to read for ketones. You have to wait for this time to read for leukocytes, and so on and so forth. With catheter sample of urine, you have to remember to clamp the catheter tubing before you collect your urine, and unclamp after you have taken your urine as well. And there is a portion, or there is a part that you have to use the non-touch technique when you are doing catheter sample of urine. So before you take the sample from the port, you clean 30 seconds, you wait for it to dry for another 30 seconds, and then you introduce your syringe or your needle, whichever way you are using it, you are doing it, and then you take your urine of 10 mils. When you are pouring the urine into the container, you make sure to use the non-touch technique to pour your urine into the container. You label it, and then you document that you are going to be taking it to the lab. When you are doing peak flow, you have to always remember to ask the patient whether they've done the test before and what was their highest reading before you start doing yours. And also try to bring the gauge back to its original position anytime the patient does the procedure. So you know that you have to let the patient make a short, sharp huff for 3 times to get your reading, and you record the highest reading. After each sharp huff the patient or the mannequin gives, you have to remember to pull the gauge back to 0 before they do the second and the third. If the range between the least and the highest is more than 40, it means you have to take 2 more extra readings. So you have to remember that. If you are doing inhaled medication administration, you have to remember that there should be a time lapse between 2 medications, different medications that you are giving. So for instance, you are giving a salbutamol and a hydrocortisone. You have to allow some time frame between the 2 medications. You don't give them together. Also remember to give the patient some water to rinse their mouth, or tell them to rinse their mouth, especially after you administer hydrocortisone, to prevent oral candidiasis or thrush. If you are giving intramuscular injection, the difference between intramuscular and subcut, always remember that with IM, you have to stretch the skin before you give the injection at the angle of 90 degrees. But with subcutaneous injection, you have to pinch the skin before you give the injection, and you discard your sharp object immediately into the sharp box. And also after you've taken your injection, do not discard your medications until after you have administered, and always try to show the medication and the ampoule or the vial to the examiner to double check whether you have drawn the right amount of medication before you administer. When you are administering a subcut and an IM injection, because they are also medications, just like you would do your implementation, you have to do your 2 forms of identification before you give. So you have to do your medication rights and everything, go through everything with the patient. And then when you are after you prepare the medication, you are about to give the medication, you double check again for the second time before you give the medication. If you are not so sure of the medication you are going to give, you use your BNF, and you also tell the patient the desired effect, the side effect, therapeutic effect of the drug before you administer it to them. You always remember to hand over your call bell to your patient after each of these skills, and tell them to call you if they need any form of assistance at all. With the fluid balance, remember that you are going to be giving a chart, intake, output, and everything of a patient, and you are going to put this intake and output into the chart and calculate it. The trick with fluid balance is, if you are given an intravenous infusion or an IV fluid, and let's say you've been given 1,000 ml per 8 hours. The trick is divide the 1,000 ml by the 8 hours and put the figure that you get for each hour. They've given you that the infusion starts at 12 and ends at 8. That's 8 hours. And the patient is to receive all these 1,000 ml within these 8 hours. And you want to know how much the patient is supposed to take per hour. So you just divide the 1,000 by the 8 hours and then you put in for each hour before you calculate. So I think with these tips, you'll be good to go. In case you forget anything at all whilst you were doing any procedure, immediately after the procedure or immediately when you remember it, you tell the examiner that in practice, you would have done this. So it does happen. They don't expect you to be 100% right. They don't expect you to know it all, but just try to verbalize it. Try to give yourself some time to think through what maybe you have left out, what you didn't do, or what you should have done. And immediately you remember it, you verbalize. Maybe you did something you shouldn't have done. You just tell them, oh, I did this, I shouldn't have done it. In real practice, I wouldn't have done that. Or I should have done this. In real practice, I would have done it, but I forgot to do it. And they are going to, once it's been recorded and it's within the time frame that you've been given, you are going to be pardoned. But once the station is over, you just have to forget it and move on to the next station. Try to remain calm throughout every procedure that you are given. And also, if you are asked if you want to start a procedure and you think you are not okay to start, just let the examiner know, I'm not okay to start. I would like to, think through, or I would like to relax a bit more. As you are relaxing, you are just gathering your point to be able to face the task ahead of you, and try to communicate anything at all, anything you are doing. Don't imagine the examiner should know what you are doing. Tell them, even if you are putting on glove, tell them, I'm putting on glove. This is the right size glove. I have checked that it's not expired. The patient is not allergic to latex, and I'm happy to use these gloves. So verbalize everything throughout all your stations, and you're definitely going to be fine. I wish you all the very best in your journey straight to the top, and see you soon as a UKRN. If you have any questions, feel free to comment in the comment section down below. I'll be leaving in my email in the description box as well. You can send me an email if you still have any questions. As I tell you, I am your partner in success straight to the top. Give this video a thumbs up if you think you like it. Share, subscribe, comment in the comment section down below, and let's keep the friendship going. Let's keep the vibe vibing. I'll be bringing you more videos as promised. Thank you so much. I love you, and see you soon. Bye.